Lots of
All
people.
right. Lots of people.
And look, they didn't stop and talk to each other or anything.
That's good. They're
Yeah.
social distancing.
They're doing a good job.
All right. We'll see. Nobody's on here yet unless, again, this is always the beginning where it's like, is anybody on here? Maybe. Oh, there's some people. We have some eyeballs.
Bueller.
All right. Hello, everybody.
Hi.
We are going to wait just a bit to get people on here. Hello, Kaylee and Tanya and Mike. Mike all the way from Ohio. Awesome. Feel free to chime in too, Mike, whenever you want. Yo, right back. Okay. We're trying to share it to our health department site too, so people can watch from there too. All right.
All right, I think it's
We're
doing
pretty
it.
sure we're doing that.
Doesn't. Oh, that's. Why isn't it? Oh, because I didn't play it.
Oh, maybe hit play. Okay, sorry. We're still.
We don't know. We don't know if we've shared it or
Hello.
not.
Hello, Robin. Thank you guys all for tuning in. While Destiny is pulling that up, we're, oh yeah, turn that volume down. Okay, because we're going to watch comments, so we want people to give us questions.
Hey, Lauren.
Hey girl. So we want people to give us questions. The biggest question that we'll be answering tonight, though, is not necessarily what to do about coronavirus, but whether or not Destiny and I are wearing pants. So stay tuned to find out. You'll notice that we're trying to social distance a little bit, but we
have a very
also
small
have,
screen.
yes. So imagine that we're using maybe the metric system or something for our 6 feet today. We're trying our best. Both of us are asymptomatic, so we feel pretty good about life right now. So let's keep it that way. All righty.
I think I shared it. If not, I'll share it after.
Okay,
Sorry.
that's all right. Okay, and we'll write down your questions, and we'll answer questions as we go along. And anything is fair game. You know, pretty much we will answer whatever you ask us, health related mostly. So, you know. All right, you guys. So we're just going to start off with a few things that we've been hearing a lot. We've had some questions asked of us about specific topics. So we'll start with that, and then we'll answer any other questions that come up. So probably one of the first things that we want to clarify is the difference between mandates, recommendations, and guidelines. So a lot of people have asked, okay, well, is this a mandate? What does this mean? What are you trying to say? Because the state has released orders. We have put out some I guess not really orders, but recommendations, yes. And then also the state or the federal government has done that as well. So when we talk about mandates are pretty much law, like temporary law, where if you don't follow the mandate, then you can actually be in trouble. So if you are, if you're gathering and there are 51 of you at this point, there's a mandate in Kansas to not have more than 50 people. So then you get like muscles like us. We didn't even rehearse that.
Yeah,
We're so
that's
good at this. You get people like us showing up at your party, and that's only cool if we're there to party, but not to break up your party. So we want you guys to do this for the safety of everybody. It's really so that people aren't spreading disease amongst each other or that kind of thing. So mandates are things like we have the 50 people guideline. There's some rumor that it may go down to 10, but as of right now, it's 50 people. Another mandate is if you've traveled to certain states, that is mandated quarantine for you. And then also the other mandate right now in the state is that the schools are closed. School buildings are closed until the end of the school year. So now that is opposed to something like recommendations, where we are recommending that that businesses are lenient with their policies, that they allow people who are sick to go home. So that's more of a recommendation.
Only essential travel.
Yeah,
that kind of thing.
Only essential travel. We don't have a statewide essential travel mandate at this point, but we're recommending that if you limit it would be best if you limit your non-essential travel. So that probably leads into the shelter in place thing. We'll just hit on that real quick. As far as people are hearing about shelter in place. Kansas City and the metro area it has a shelter in place order. So does Douglas County. Wichita is debating it at this point. what that means, and we can kind of talk about this together, is that it's not like you're stuck at home and you can't go anywhere. You get to do the things that are essential.
Yeah, you can go to the grocery store, you can go to work. If you can't work from home, you can do those moving about things. They just really want it limited to stop that community spread that they have going on there.
Yeah. So again, not anywhere cool, but just the places that you really need to go.
Yeah.
So
the grocery store.
Like the grocery store, which is cool. Don't get me wrong. It's very cool at the grocery store. So, well, since we're talking about food, maybe that's our little topic.
Yeah, so we have had questions about if it's safe to go to a restaurant and eat and get food there. There are two answers to that. It is safer if the restaurant is providing takeout service or is really adhering to that under 50 mandate with the rules that the governor put in specifically for restaurants, 6 feet apart for tables and bar stools, and the other one was no salad bars or buffets. So as long as those are being followed, that's one answer. That is safer. And then the other answer is that it's droplet transmission, this COVID-19, and so when you're eating at a restaurant, it really doesn't spread in the same way. You don't get it off of the food when you ingest it. It's not a foodborne illness. So if you get a to-go box, and this is really gross, guys, and I'm sorry. If someone sneezes on your to-go box and you touch the to-go box and then you eat your food, it's probably not going to make you sick. But if you touch the to-go box and then you touch your eyes or your nose,
or someone else's eyes or nose. Don't do that.
Don't do that ever.
It's weird always.
But yeah, so that is more likely to make you ill than actually ingesting the food. So cooking at home and cooking and eating out is okay, as long as you're not touching your eyes or your nose.
And how long food?
Oh yeah. On non-porous surfaces and plastic, stainless steel, things like that, the virus can live up to 3 days. And then on porous surfaces like cardboard and stuff like that, it's about 24 hours. So of course, whenever you transfer food and you move things around, that virus gets fluffed around, I guess, if you will. Fluffed. That's the technical term. It gets fluffed around and it decreases the number of virus bits.
So one question, virus bits.
Virus bits.
I think this is so straight up medical, thank you. So one of the things that somebody mentioned was just talking more a little bit about the difference between droplet and airborne transmitted diseases. So our examples of droplet transmitted diseases are influenza and the common cold, things like that, where you have to have like spit and saliva and all that getting on surfaces, and then someone has to touch those surfaces, and then they touch their own mucous membranes, nose, eyes, mouth, whatever. That's opposed to an airborne illness like tuberculosis. That's why back in the day when tuberculosis was still cool, that they used to put people in like sanatoriums. You know, they're just not around. It's hard to remember. So you had to really isolate people and have people breathing different air. So that's why hopefully we're not dropping everybody.
People?
Anyway, someone tell us if we're dropping our signal. But anyways, so that's why we don't worry about being in the same space. So 6 feet is pretty safe that way. So it's not just breathing the same air as somebody who has the disease. Now it can be, it's been shown that it can live in the air for a short amount of time, but that's not where we're seeing transmission happen. All right, does that make sense? All right. Good stuff. Oh, Peyton's calling. Can we decline that for now? Okay, we don't have time for children right now. We've got disease to kill. All righty. Sanitariums. There we go. See, sanitariums. It is a thing. I don't know.
My bad.
They're just not around anymore. Bring back sanitariums. Just kidding. Okay. All right. Looks fine.
Do you want to talk about this since we're talking about?
Yeah, let's do it.
Okay, so with this droplet transmission, the recommendation for people who are coughing or exuding symptoms, fever, all that, is to wear a mask to keep those droplets in. And for healthcare workers is to wear a different type of mask to keep those droplets out. They're two different kinds. There have been a lot of things on Facebook, things on all over the place about homemade masks, home sewn masks. We looked into it on CDC. There is a lot of information on either side of this. So we're going to go with CDC recommendations here and say that homemade masks should be used only as a last resort. They are not considered PPE, and if you're using them, especially in healthcare, you need to have a face shield, just a piece of plastic that goes down below your chin and on either side of your face, so that those droplets can't get into
Like Jurassic Park.
so those droplets can't get into your mask and get kind of stuck there right by all those mucous membranes. We don't want them in. So
That was my best, like, tiny velociraptor. No, that was the other guy that has the thing.
Yeah.
So there's also a question about, like, should people be making them? I know that people are really wanting to help, and that's great. So it just may not be as helpful at this time, anyways, to be able to make those cloth masks. So, and then there's a lot of other materials out there that people are talking about. Can we use vacuum filters and coffee filters and things like that? Right now, in our county, we do have PPE, so appropriate mask, and we know that we can reuse N95 masks, things like that. But so we're not there yet. But in the future, if that becomes the case, then we'll try to figure it out. Some people are using, like, bras and stuff. I already offered mine, but they're only toddler size. Can I say that online?
So when we say PPE, we are meaning personal protective equipment. In case those of you who don't know what that means.
Yes. Oh, yeah. Personal protective.
Okay. Try and not throw acronyms at you.
Yes. Sorry about that. So another thing that people were asking about last time we were here, we were talking about NSAIDs. So that is non-steroidal anti-inflammatory drugs, and that would be things like Aleve, Advil, ibuprofen, meloxicam, Celebrex, those kind of medications. So what we've found within the last week or so is that it does not increase your risk for contracting coronavirus, but what they are finding is that possibly if you do have coronavirus, if you are on NSAIDs, then maybe that's not the best. But there's not enough evidence to stop NSAIDs at this time or to warn against using them. So if you're using them now, you don't have coronavirus, then you're okay. If you do get coronavirus and you have mild symptoms, like 80% of the people out there who get coronavirus, then you might want to try to use Tylenol instead of Advil or Motrin or one of those, just to be safe. But again, there's not enough evidence out there right now. So don't toss all your NSAIDs or your Advil in the trash. You'll probably be okay. Yeah. Is there another one that came up?
Not really a question. It's
mask or no? Oh. Can I get a script of hydroxychloroquine? So, great question. We're not prescribing at this time, but look at our candy dish up front in the clinic. Just kidding. It's only filled with Xanax. Just kidding again. Okay. This is where I'm asking you to not make me lose my license on all these things. So, hydroxychloroquine has been shown in some people, especially with severe disease in the hospitals, to decrease the immune response to what's happening. We're finding that the reason why people are dying from coronavirus is not exactly the virus itself, but the virus is triggering our immune system to do what it's supposed to do, to try to fight things off. But what happens is it produces such a severe reaction that then your lungs fill up with fluid and you end up with not being able to breathe anyway. So the way that hydroxychloroquine works, it's usually used for things like rheumatoid arthritis and other autoimmune disorders. So it kind of shuts down your immune system so you don't have such a severe response. So that is to say, I see one of our former pharmacists, Jake, on here. Don't run to the pharmacy and try to buy up a whole bunch of hydroxychloroquine. It's not going to do anything, and it's not helpful if you have mild disease. But luckily there are some treatments out there that they're working with, that along with azithromycin, which is in those Z-Packs that you guys always ask me for randomly. Don't ask for Z-Packs. That combination has been tried, and we're seeing some good results with that. Okay, was that more information than what we needed? That's
Nope.
okay. We're going to
Nope,
give you
that
too
was
much
good.
information.
Yeah.
Oh, thanks. We are cute. Okay. Let's see. How about childcare? Do you want to talk about that?
Yeah, childcare. So,
Care for your children. Next topic.
so schools are closed and not canceled, but closed. So there are a lot of people that need childcare right now, and there is no intention from the state to close childcare centers. They know that parents need to go to work. If they need to go to work, and they know that childcare is important. So what they are doing is they're just trying to educate and keep childcare facilities to small groups of kids, under 10 in a classroom, under 10 at a childcare center, anything like that. But they have been very straightforward about saying they are not interested in closing down childcare at this time.
And we'll do our best, because I think they're going to. Don't touch her.
I have to itch my nose.
Great, there she goes. I'll be doing this show solo next time. Thanks a lot, Des. But yeah, I think they're gonna be one of the highest monitored little tiny people running around, because we also don't want them to spread it to their parents and families as they go home. Another question we had was about ventilators. Do we have ventilators in the county? We do. I believe we have a whopping 2 ventilators, but we also know that those ventilators can help multiple people. So again, the whole idea behind trying to flatten the curve is that we don't get overwhelmed where we're going to need multiple ventilators. So this is why we're doing the things like staying home and canceling school, things like that, so that we don't have a whole bunch of people get sick all at one time, and then all of a sudden we don't have ways to take care of them. So, alrighty. There was a question about warm weather, and that comes up a lot. What we don't have any evidence that shows that the warmer weather is going to make this virus go away or not infect people.
Yeah, they're hoping that's the case. Sorry, I'm distracted. But they're hoping that's the case. They're hoping that people being able to be outside and in the fresh air will slow it down, because people aren't going to be kind of as bunched together. And they're also hoping that it'll be seasonal, like influenza, and it just won't spread as well when the weather's warm. And we hope that's the case, because it's getting warmer, and that would be great luck.
And then it's getting warmer, and then it's getting colder, and then it's warmer, and then it's colder.
But so, we're moving toward warmer weather.
Oh, tell me more about severe weather.
Oh,
Destiny?
Speaking of severe weather, we had a question about it. The question was if there's a chance for severe weather this evening and tomorrow. If someone who is quarantined right now needs to go to a shelter in case of like a tornado warning or anything, can they do so without punishment? And the answer is yes. We don't want people staying home if they need to seek shelter due to severe weather. So what we do want is for them to try and be transparent, and let's be nice, people. If you're in a shelter with someone that says, I'm going to be quarantined, don't be giving them the stink eye, or,
I don't know, is this the stink eye?
Gotta be close. But
or 2 stink eyes.
But try to keep your distance from them. They'll try to keep their distance from you. We are really hoping that that won't happen, and that Mother Nature will let us off the hook here. But if you need to go, go.
And stay, remembering that our most vulnerable population is those that are above 60 years old and people with chronic conditions. So if you do know that you're quarantining or you've been exposed or you have a higher risk of having coronavirus, then please do plan to stay at a little distance from other people who might be more vulnerable.
Yep.
Grab a kid and use them as a shield. Just kidding. Not really. That's also a bad idea. Sorry. I need to stop saying things that are not things. I know.
You need to.
The things that... So let's see. We've had some other great questions that have happened today. People ask about washing their food. Is it better to be to have food delivered, or is it better to have to go grocery shopping? In theory, delivery exposes you to one person versus a whole bunch of people, and yes, I will address that other one in a second. But instead of exposing you to a lot of people, and if we keep people kind of out of the grocery stores as much as possible, then we don't have people coughing on things and spreading those droplets everywhere. Do you need to wash your food? Yes, but soap and water is fine. The soap breaks down the membranes of the virus, and so we're able to kill off viruses with a good soap washing if it's soapable, if you can do that. I believe all the liquor stores are going to stay open, at least the drive-through. So that's a very important question from Toby. Thank you. Let's see. Are there any known antivirals showing some relief from symptoms? They have been using different combinations of antivirals in different parts of the world. We don't have anything that's just a definite, like, hey, once they are in the hospital and they're severe, you should try these antivirals. I know they're using them in multiple places, so we do need to just keep an eye out for that. Every day something changes, so maybe we'll come up with that miracle drug, you know?
Yeah.
And then we'll put that in a candy dish, and then you can come to my clinic.
Yep.
All right.
Oh, go ahead.
Oh, no, it's okay. Which one do we have next year?
I don't have.
We're doing a Facebook Live. And Daryl's going to walk on by. Okay, thank you. Daryl is our trusted lab guy here in Wilson County. So he's what we call our swabologist. He went to swabology school.
Swabology.
He's a doctor of swabologistness. Okay. I'm going to address this. I know this is kind of a sticky subject because it's one of those touchier things, but I think it's important to address. People have commented on why we're calling this virus the Chinese virus or whatever else. I'm going to bring it up because, again, we're talking about everything here, and everything's fair game. Obviously this virus did start in China, and we started seeing the cases in China. One thing that I want to bring up is that every virus starts somewhere, right? So, and I did some history reading on this. So we have the cholera outbreak in Russia in 1817. We had a plague in Sicily. We had some Roman business going on. That was no fun. Nobody likes to be in all their Romy stuff and have some sort of plague-ish thing happening. We had the London plague, the Spanish flu, the Fiji measles. We had HIV that started in Africa. So just remember, people hear these things, people say these things. I don't know if you guys know this, but I am Asian. I know, it's a thing. I know. So, when we say these things, they can be hurtful to people because nobody has meant for this to happen. The only thing to blame for all of this is a virus that decides to mutate and be a jerk around the world. So just please remember that, because we realize that this is affecting everybody around the world, and we want to support each other as much as possible. Mm-hmm. Will that work okay? That was a question that came up as well. Yeah. So, what other questions do we have? I'd like to say hi. Oh, hi from the Philippines. See, there we go.
Yeah,
we're Asians.
We're all in this together.
Okay. People ask about how long are we maintaining social isolation. We don't know, actually, at this point. Is the real answer a month, 2 months?
Yeah, so the governor gave a news conference today, and Dr. Lee Norman was on there, and the projections from the KDHE epidemiologists say that by the end of the month we could have 300 to 400 cases in Kansas. So that's a lot, and we have 82 as of 10 o'clock this morning, with 2 deaths. So 4 times the number could be happening. So we definitely want to continue the social distancing as long as we can, because we really want it. We really don't want it.
We just don't want it.
Yeah.
And just in case you weren't sure, virtual happy hours are a thing.
Yeah.
Virtual family gatherings. It's just as fun. And then you can fake that your internet connection went down when you're like, oh, I'm kind of sick of this.
I'm done.
Yeah, thanks, we're out. Not that I would do that to you, but if I did, you would know what would happen.
Yep.
Okay, what other questions do we have? Yes, Dr. Mendiola was not Italian, I tell you.
Oh my.
What a stinker. Let's see. Yep, viruses are jerks. People don't have to be. That's great.
Oh, who said that?
Oh, that's from Amy.
That's
Thanks,
perfect, Amy. Thank
See,
you.
and we have people doing virtual happy hours. So there's a question. The last I saw is that we aren't necessarily using steroids in all patients that are being treated for coronavirus because it may not show effectiveness. So that's why I think we're leaning more towards the hydroxychloroquine. But we can do, every day things are changing because a couple weeks ago they said no steroids. So maybe at this point we may have a different answer too, right?
How about this one?
So Ashley here mentions that Dr. Norman said in a press conference that this could peak in January to February of 2021. What would that mean for social distancing? It's a great question.
It is.
Because we don't know. I mean, because if we all end up doing this forever, we'll probably go insane, and then I will start delivering Xanax to everybody. And it's fine, Xanax for you and Xanax. We'll just actually put it in the water. That seems like a better option.
Yeah.
So,
yeah.
But it could be a thing.
It could, and realistically, social distancing could spread it out over a longer period of time, which is what we want because we don't want to over utilize our healthcare system and run out of everything. But we hope that it won't last that long.
And it probably won't look so much like this, so much
yeah.
Extreme social distancing.
Yeah.
It probably, because we see that there is probably going to be like a shelter in place or stay at home order probably in the near future. Right now, Kansas hasn't done it as a whole state. Some of us believe that we should. I don't know. What am I doing? Voicing my opinion. But that may be a good option for us. We also know that we can do that as a county, but that relies on our county people deciding that they're really going to follow it, and then that means that we don't necessarily want to also have other people traveling within the county and things like that. So it's all about staying responsible, doing what you need to do, but not trying to put other people at risk. Anyways,
Shannon, when you asked about services, in case someone else wasn't on here, so as far as services goes, the virus can live on cardboard or organic surfaces like that for up to 24 hours. On non-porous surfaces like stainless steel or hard plastic, it can live up to 3 days, and then shortly in the air as the droplets kind of.
Yep, surfaces like this.
Just like that.
Rare. Not to be confused with. Okay, so let's see. So there are questions about what happens if you get coronavirus and then when you recover from it. So just like you would be most likely, most people are going to end up building immunity to the virus after you recover from it. Hopefully everybody recovers and we're fine, but we know that's not exactly the case. What we see is there is a threshold, and we kind of talked about this last time, so I apologize if it was a repeat, but what we see in a community is that you get a certain threshold where enough people have been infected in the community that we have a sort of herd immunity. So if we've got like 40% of the community that's been infected, then about every other person almost is going to have already had it, recovered from it, and then they will not get infected again, and so they won't be infecting other people. So you can recover fully from it, especially young, healthy people, and not be at higher risk for other things later on in life, as far as we know. Having said that, people do recover, people, then they go out back into the community once we have all this social distancing stuff that we no longer have to stay in our rooms and do virtual happy hours and yada yada, then we can go out and about. But that probably looks like that doesn't mean that coronavirus is going to be completely gone at that point. It's still going to be around, so we still have to be careful.
There was another one that I saw, but I don't remember what it was.
So we've had a lot of, and I will just say, we've had a lot of support of people agreeing that it's probably not best to be traveling outside of Wilson County or, traveling around and doing non-essential travel. So I'm going to go out and say that I agree with that. I would love to see a state mandate because I think we do need to be aggressive. Hopefully I can say that online and it's not like, but what are we going to do? This is a pandemic time.
It's not our choice. So.
Yes, but we can try to do our best and do our best for our community.
Yeah, and there was a question if there are any cases here yet, and there are not. We don't have any confirmed cases in the county. There are counties around us, however, that do have confirmed cases. So we're still continuing to be vigilant.
Yes, absolutely. There's a question about whether so if you have a college kid that you're sending your college kid back soon, and he lives in a county with 2 confirmed cases, should I have him wait? I think last time what we had decided was, when in doubt, you should camp out. That's what we came up with. When in doubt, camp out. Or quarantine. So if we're not sure, make sure that they are willing to hang back and really take those precautions, stay 6 feet away from people and all that. Now, when it comes to the official mandate, there are only specific states and specific counties and things like that, and reasons why you are mandated to stay quarantined. So not everybody fits that definition or those criteria at this point.
Yeah.
So, and we can help sort that out. So if you have questions, you can always ask us for specific examples.
Yeah. There's a question about if our community is giving test kits for people who have symptoms of the virus. We are not giving test kits. If you have symptoms and you think you've been exposed to COVID-19, we urge you to call your doctor. They have test kits. Yes. Don't just show up, call them, and they'll kind of talk you through it, and we'll work through it.
And do you want to do a quick repeat on the cloth mask?
Sure.
One more question, but
yes.
just a reiteration.
So cloth masks, we're using CDC guidance when we say that they should be used as a last resort. They are not considered PPE, and if you do use them, you should use the clear, the face shield that comes down below your chin and past the edges of your face, just to protect your mask, basically.
Yeah.
So
last resort, anyways, for the cloth mask. And somebody asked, like our pink ladies or our auxiliary ladies were offering to make masks. Go ahead. We don't know where we're going to be in a month or 2 or 3 months, and of course, we always appreciate people helping. We just don't want to hurt anyone's feelings if we don't use them right away.
Yeah, and don't worry about it, Lindsay. Lots of people come and go.
Yeah. You guys can watch this when you go to bed tonight. I mean, it'll be the best thing,
Mm-hmm.
And then wake up watching it.
We'll be viral.
Yes. But not like coronavirus.
But not coronavirus.
No, like a good viral.
Yeah.
We'll figure out what a good virus is at some point. All right, let's see. How many kits do we have? We actually have plenty within our county. So right now we are being very choosy with who we screen, and not and meaning that we're using the criteria and making sure that we're screening only, or that we're only testing people who are symptomatic at this point, which is the recommendation. And even with that, to test for the state, there's even stricter.
Yeah, they're very strict
criteria.
on who we can test at the state.
So we don't want you to have any concern for us not having enough kits in our county. We have plenty, but at the same time, that doesn't mean that we should just test everybody also. We don't have the resources within the country to be able to just test everybody. And I know some places are doing it, some countries are, but we don't have that at this point
right now.
All right, you guys, what other questions? And if we missed any, let us know. We're trying to catch everybody, but we don't want to miss anybody. Hey, do you want to spout out the different counties that it's present in right now?
Sure. Yeah. You have today's? Yep. Okay. So, counties in Kansas with confirmed COVID-19
disease. Actually, hold on. Let me pull up this one. There it is.
In alphabetical order.
Nice. Oh, great. Are you doing that yourself?
I am. Butler, Bourbon, Cherokee, Douglas, Franklin, Jackson, Johnson, Leavenworth, Lynn, Lyon, Mitchell County, Morris County, Pottawatomie County, Reno, Sedgwick, and Wyandotte counties. So,
and my follow-up question would be, where the hell are all these counties? I haven't even heard of most of them, but
The whole eastern side of the state, all the way down from top to bottom, is
well, now you know.
now red.
we also do geography, not just health. Look how good we are,
Yeah.
multi-purpose.
I had to make a map. So I know.
But yeah, so it's near. It's not here in Wilson County, but it's nearby.
Yeah, I don't.
And that's
Rebecca.
Rebecca.
Yeah, it's taking a long time here too.
So we're seeing tests take like 7 days to come back. They can be as soon as 24 hours maybe from the state if we're lucky, but they're overwhelmed. So up to 7 days also. Is it possible this virus was actually present in the U.S. back in the fall before all this hubbub happened? The coronavirus has been present for forever. I mean, it's a whole family of viruses. We don't believe that this coronavirus has been present until it made its way here. And part of that is the problem because none of us have any immunity to it. And so we don't believe that it's been present. Other family members of coronavirus have been around, but not this one.
Yeah.
Both kids called you. Oh man, my husband just said both kids called me out for using the word hell. Prepare to receive a lecture. Kids these days, I tell you. Why? Why can they pick up on everything?
This one asks if you have an autoimmune disease and you're past 60, do you recommend not going to work? We would definitely recommend. If you can work from home, do work from home. But honestly, we're recommending that for everyone. Just be careful when you go to work. Distance yourself. Try and stay that 6 feet away. Wash your hands a lot. Don't touch your face a lot. The same kind of things we've been. If someone is sick, let them know they can't be at work. Things like that are the way to protect yourself there.
And we heard after our last call and in between, or our last Facebook Live, that there was some concern about businesses not sending their people home. And so we tried to address that in a recommendation from the county to say, hey, as an employer, your job is to send employees home. If they're sick, we'll figure out the rest. Because then what we also got were employers sending people home and saying you have to tell your doctor that you have to get tested, or you have to be in a 14-day quarantine. And that's not the case. We are here to help figure out what the next best step is for the employees. So, and as an employee, we get that it sucks because if you're not working, you're not making money. And we know, and that's going to be a hardship all across the world, I think. But we aren't going to have a good workforce if we have people that are spreading disease within different workforces, I guess, within the different buildings. So,
yeah. Are there other possible symptoms besides cough, fever, and shortness of breath? Possible, yes. Those are the most common ones: cough, fever, shortness of breath, headache. I've heard quite a bit, sore throat, things like that. Some people are having GI symptoms. They're feeling nauseated or having diarrhea, but those aren't as common.
Yeah. And that might just be a burrito you ate that you shouldn't have eaten.
Could be.
Consider it. I've done it. It's a problem. Let's see.
I don't remember you saying how.
What else? Any other questions? We'll do a last call and see if anyone has any other questions. We're at about 6:10. Like we said, we will continue to update you guys. Apparently, there are still people watching, so until we get down to where everyone's like, there's actually like less people watching than there are in all of the world.
Oh,
Jenny
thanks,
Destin.
Erin.
Oh, thanks. Our job here, and we kind of didn't say it at the very beginning, we probably should state why we're doing this. So Destiny is our Wilson County Health Department Administrator, and I'm the County Health Officer. Our job really is to just inform people, because we know that when people don't know, that's where fear sets in, and that's where we start hoarding, or we start blaming and that kind of stuff. We just want people to know the facts. We'll try to gather the information because we know there's so much out there on social media and on the TV and in newspapers. So if you have any questions at all, please don't hesitate to reach out to us, and we'll take care of you guys. We'll help figure things out together.
Yeah. So if you go to Johnson County, or we'll just expand it and say the Kansas City metro area, the question was, should you be cautious? And yes, but I would go ahead and say that you should right now always be cautious. We do know that there's community spread in Johnson County, so if you must go to Johnson County, it's not unlawful to do so. Be aware of what you're touching, be aware of people coughing, like just try and distance yourself as much as you can. And then when you come back, continue to be aware. I think that's the biggest thing. We don't want anyone being scared or being fearful, but be aware of your surroundings and be aware of who's around you and what you're doing to possibly infect other people.
Let's see, do you guys have enough gloves and masks for your nurses at the hospital? If not, how can we help with that? We don't know how long this is going to last. At this time, yes, we have enough to protect ourselves, but in the long run, I think a lot of our communities are at the point where we don't know if we're going to have enough in the end. Like I said, we're reusing masks, but that's okay. We're not just like shaking them out and like it's like, can I do that? Now I'm just getting droplets everywhere. But so we're sorry. This is our last show. We just decided. But we are reusing the mask in an appropriate way until they are not able to be used, like if they're soiled or if they become wet. So we're trying to make these things last as long as possible without increasing our risk of exposure. So, but please do help if you have ways to help.
And we have some regional resources and state resources that we can tap into as well. We have the plans in place for all of that. And Eric, we're recommending only sticking to essential travel, but there's no mandate for quarantine unless you go to those specific states or specific counties.
There's another question about allergy symptoms. They can mimic the symptoms of COVID. How can I tell my coworkers I'm safe to be around? It depends if your coworkers like you in the first place. I'm just joking. The best way to do that is to contact your doctor, and then that way we can evaluate you, decide if that's the case, and then we can actually write a letter to your work if we need to. We're not encouraging everybody to have to get work notes to go back to work, but of course if you have like chronic allergies and we know this and we usually know you best, your doctors, and we can write those letters to help you get back to work so people aren't afraid of you. And yes, it says I am Fredonia. We had a virtual spirit week this week, so people who aren't good at reading backwards, people are asking. All righty, let's see. What is the third word? Okay, there was something up here about, sorry, we're trying to look. And Mike, any advice on where to get toilet paper? Don't come to Fredonia to find it because we need it for ourselves. We eat lots of fiber in Wilson County. We're very regular, so don't take our toilet paper. And don't hoard it. Just get normal toilet paper amounts, please, people. That's our plea. Just do normal toilet papering. Okay, let's see. What else do we have here? Thanks. Can I go to the doctor's office if I'm due for an allergy shot if I'm in quarantine? It's a great question. If it's not essential at this time, which an allergy shot would probably not be considered like a necessary treatment, I would say that you would wait until your quarantine is over. But again, talk with your doctor about that. We are doing visits on the curbside. I did a visit out of a van today. That sounds like handing out candy. That's like, no, I was not in the van. Someone else was in the van. Actually, multiple people. I'm just going to stop at the van thing. But so we do visits from vans, from virtual visits, phone visits, so we can figure that out together. And there are questions. I know some people have voiced to us even after our last Facebook Live that there's a lot of anxiety, and that's what we're here for, is to let you know it's going to be okay. We're going to get through all of this together. We might be 6 feet apart when we're together, but we are going to get through it. It's going to pass. In the meantime, we just have to do our best to slow it and take care of each other in the meantime. Yeah. Okay, what else do we have? All right, such nice things. You guys are so nice to us.
They are. They are.
I don't know that we deserve this, but
I doubt it. But but it's gonna work. It is gonna work, and I have seen it all over town. People being aware and we were just watching people out the window a second ago, and they were all walking their dogs, and they like moved around each other and didn't even stop and talk. And while it's not very small townish, it's a really good, very good social distancing. So
yeah. And we want people to be out and about doing stuff. Like, that's great. We still need you to be healthy for when all of this stuff is over. So go outside, do your thing, but if you normally would stop and chat with people or whatever, then maybe just do it from a little bit more of a distance.
Yep.
Yeah.
And I will say the only other real, like, repetitive questions that I have had have come from, I hate using I'm going to say cosmetologists and hairdressers. I don't know if that's the right nomenclature. I'm sorry, guys. But
please don't yell at us. We're saying things wrong.
Please. But we've had a lot of questions because those folks, they're close to you when they're cutting your hair and stuff. So please be mindful of how close you're going to be to them. And if you are not feeling well or if you've been traveling, do not go get your hair done. You'll look fine. But we need to keep them safe too.
Yes,
so
absolutely. And then there's a question, we kind of addressed this earlier, but I heard the governor was going to mandate only groups of 10. Someone mentioned that they thought it may have already come out, but I don't like right before this it hadn't, but that's the rumor is that they're going to mandate.
Yeah,
10.
and they said that in a press conference today that they planned on doing that. So I would say yes, that's probably true.
Yeah. But JJ, luckily you only have like 6 friends, so you don't actually have to worry about that. So thank goodness. Just kidding, JJ. All right, you guys. Oh wait, I had a telemed visit from Johnson County. Insist on a virtual visit and stay home. Absolutely. Great. Virtual visits, phone visits, we can do them all. We've got all kinds of options for you. All right. Anything else that we might have missed? Repost it. Otherwise, we're kind of planning on...
yeah, we weren't even planning on this one, honestly. People were just like, hey, we want to hear from you guys again, so we did it. So
it was mostly our moms. I think they're just being nice, but I guess people showed up. They might be bored.
They could
social
be.
Distancing.
Everyone's social distanced. But if you have questions, you can send them in Messenger. We won't necessarily call out your name. There's no bad questions.
Like I just said about JJ. Yeah, well, sorry, JJ.
Sorry,
but
JJ.
That's JJ.
But if you don't want us to say your name, we won't. You can email the health department. It's wlhealth@wilsoncountykansas.org. It's very long. We have a Facebook page. You can send us questions in Messenger. Post them on our wall. We'll answer anything. I've gotten a lot of questions, and I think that's great. I'm glad that people are reaching out and asking questions and not panic and thinking this stuff through.
Can doctors do med refills on phone visits? Absolutely, but you just need to check with your doctor because there may be certain restrictions on that. So just make sure to check with them. Eric, you said that Maggie had a question, but I can't find which one that was. It might have been earlier. So if you can repost it for me, that would be great. Maggie Rice's question. All right. This feels like I was out with friends. Right? This is basically a virtual happy hour. I mean, feel free to turn our Facebook Lives into a drinking game every time we say something weird or try to make a joke. Yes. My wife has me in quarantine, but that's different. Awkward. Yeah. That's a whole other thing. We'll address that in a different Facebook Live. Okay, Eric, if you can help me with Maggie's question, I don't see it, and if you can repost it for us. So, otherwise, a couple more minutes, and then we will try to shut her down so you guys can get back to other fun things happening in life. How many confirmed? Oh, that's an easy one.
None.
0 in Wilson County.
Cases in Wilson County. We're doing it right, but we need to continue to do it right. But no, we do have some tests pending. I don't have that number off the top of my head, but we do not have any positive cases in the county.
All right.
Another kid calling.
Okay, and just in case, Maggie, we'll look back, and if we haven't gotten your question answered, we'll answer it on the comments here. So. Anything else? Thank you so much for everybody joining us. We'll either, depending on how this week looks, we'll either be back on here later on in the week or next week. So if we're all social quarantining and whatever, then we may have nothing better to do than to talk with you guys. So, I see. She has a surgery appointment in Wichita. Are there any confirmed cases at hospitals that you're aware of? we can say there's 2 in Sedgwick County.
But I don't know where they are, Maggie. Sorry. My advice would be call your surgeon and just make sure that it's safe for you to go.
There's a lot of surgeries that are being postponed if they are considered elective surgeries, so non-urgent surgeries. So they may want to consider whether or not to do your surgery or even to come up for a consult. And again, if you need to go to an appointment outside of the county or in some of these other areas like Johnson County, it's okay to do it, but always check with your doctor first, because they may say, well, we didn't think you would come up here. Why did you do that?
Yeah.
I was just here, and they spend like 2 minutes, but
Yep.
so make sure you check with them first. Communication is always the best.
Yep.
All right. Okay, you guys, thank you so much for being with us today. We hope it was helpful, and we didn't say too many ridiculous things, but just the right amount.
Just a little bit of ridiculousness.
Just a smidgy, yes. All right, stay away from each other in a loving way, and we will, can I say that? I don't even know.
Yeah, might as well.
All right.
Thank you, guys.
Thank you. And I know how to turn this off now, so it's not going to get weird. Bye.